Hi, I'm Rosemary Clay, the Executive Director for the Bergen Newbridge Medical Center Foundation, New Jersey's largest not-for-profit hospital and the sponsor of In the Know It Row, an informative conversation with leading physicians on important health topics. Today I'm joined by Dr. Skeete-Jackson, a physician specialist at Bergen Newbridge Medical Center in Paramus, New Jersey, and Rutgers, New Jersey Medical School Department of Medicine Division of Cardiology. Dr. Skeete-Jackson is board certified in adult echocardiography by the American Society of Echocardiography and board certified in nuclear cardiology by the American Society of Nuclear Cardiology. Her interests include preventive cardiology and medical education. Sudden cardiac arrest can strike persons of any age, gender, race, and even those who seem to be in good health. World-class professional athletes at the peak of their fitness have been known to die suddenly during sporting events. This is often the result of sudden cardiac arrest. The heart stops suddenly and unexpectedly, blood pressure drops, blood flow screeches to a halt in the brain and organs, breathing ceases, and the person loses consciousness. Without quick intervention, this arrest can quickly lead to death. Today, Dr. Skeete-Jackson will discuss with me what is sudden cardiac arrest and how sudden cardiac arrest is different from a heart attack. Thank you for joining us today, Doctor.
Thank you so much for your introduction, Rosemary. It's a pleasure to be here with you. And, I congratulate you on having this forum, talking about general health topics with the public. I think it's very important.
Thank you. So what is sudden cardiac arrest?
Well, you did summarize it very clearly, so I'll repeat it. Sudden cardiac arrest means that the heart stops functioning. The heart is a pump that works to send blood around the body to all the organs. And the blood is used to oxygenate the tissues and organs, meaning that the organs and tissues need oxygen to survive and carry out their function. And the heart is responsible for getting blood everywhere and also transporting the oxygen from the lungs to the tissues as well. The heart is also responsible for allowing the veins or the other types of blood vessels, to bring the blood back to the heart and then continue this exchange. So it's a vital organ, and if it stops working, we stop functioning. So sudden cardiac arrest means that the heart stops pumping.
Okay.
Once the heart stops pumping, we do not get the flow to the organs, and the organ that needs that blood flow the most is the brain. The brain is also, very important. We always have neurology versus cardiology, brain versus heart. But if the brain does not get blood flow for 1 minute, the function starts to change. And after 3 minutes, the cells in the brain start to die. And when you get to 9 minutes, then we talk about brain death. So we have that very narrow period of time to try to do something about the arrest or this pump that has stopped working, to try to intervene so that the brain does not die, thus the body dies. If there's no intervention, you have this arrest and nothing is done, then you get what we call sudden cardiac death, or the patient dies.
So what causes sudden cardiac arrest?
Well, a lot of the times we never find out what causes it because, the person dies. And the majority of cases of sudden cardiac arrest occur outside of a hospital. But in the cases that we do find, or we're able to do an autopsy, or we're able to get to the person before they reach that critical stage, the most major cause is what we call ischemic heart disease. Ischemia meaning lack of oxygen. So if there's a blockage in the blood flow in the heart, either acute or something that's been there for a long time, leading to possibly leading to a heart attack. This is the most common cause of a sudden cardiac arrest. Sometimes this is not the cause of. There's nothing that's blocking the blood flowing in the heart. The heart just goes into an abnormal rhythm. Abnormal rhythm, also known as arrhythmia. It can be a rapid or a slow rhythm, but in the cases of the sudden cardiac arrest, it's usually a rapid rhythm, or what we call a tachycardia. So an arrhythmia occurs, and the electrical activity of the heart goes haywire, and then the heart stops pumping because the electricity in the heart is not moving well.
So why is it so sudden?
Well, you know, it's sudden because of that small window of time we had that we can survive without getting oxygen to our brain. So within a few seconds to a minute of no blood flowing to our brain, we're going to collapse. And this is where the sudden comes in. And time is brain. Time is heart and time is brain. So this is why it's so sudden, because we cannot survive for very long if the heart stops pumping that blood to these vital organs, the most important of which in this kind of case is the brain. So the person collapses or faints, and then they stop breathing, and the heart stops pumping.
So what's the difference between a cardiac arrest, a sudden cardiac arrest, and a heart attack?
Right. A lot of people confuse these because, especially, watching the movies, I have chest pain, I'm having a heart attack, I collapse, let's get them to the ER stat. We all watch these movies. But a heart attack is one thing that can cause a sudden cardiac arrest, but it's not the only thing. So blood flows throughout the body through our arteries and moves back to the heart with the veins. And so you have arteries going all around the body, supplying all our organs. And you also have arteries that go from our major blood vessels into our heart. Because the heart, it's pumping the blood, but it also does need blood itself. It also does need this oxygen that we breathe in through our lungs. So a heart attack occurs when the blood that's flowing in these blood vessels that supply the heart is stopped due to a blockage in the blood vessel in the heart. It may be very acute, something that occurred over a few hours, or it may be chronic, something that was building up over years. So a heart attack generally is caused by deposits of cholesterol in these tubes that carry the blood to the heart. So over time, you eat lots of fatty foods, you smoke, genetics play a huge part, and then cholesterol gets deposited in these tubes or blood vessels that are taking blood to the heart, and they're very tiny. They're millimeters in diameter. So over time, you get these cholesterol deposits and then damage to the walls of the blood vessels or tubes inside the heart. And then when that plaque, is what we call it, a plaque or blockage, builds up just enough that the blood can't flow anymore, you get a blockage, you get chest pain, and then you get a heart attack. Heart attacks are treatable. If someone's having chest pain and having the typical symptoms of a heart attack, pain that's central, that may be going to the neck, to the arm, lightheadedness, maybe palpitations, but typically chest pain, problems breathing, sweating, we should always seek urgent medical attention or call 911, because that blockage can be opened if the person is taken quickly to the hospital. Now, going back to sudden cardiac arrest, this is one thing that can cause a sudden cardiac arrest or cause the heart to stop pumping, because if you have this blockage in the blood vessel in the heart and the heart's not getting any oxygen because it's not getting any blood, if it's bad enough, the heart's going to stop. And that's a sudden cardiac arrest. So the blockage in the blood flow to the heart causes the heart attack. The heart attack can cause the sudden cardiac arrest. There are other causes of sudden cardiac arrest, excluding heart attacks. Again, arrhythmias, which is just an abnormal rhythm that develops. And then another common thing that can happen is heart failure. This is a very common disease, usually in the older population, where over time the heart gets weaker and weaker. The muscles aren't pumping the blood as well due to many factors, usually chronic illnesses. But heart failure. If the heart gets weak enough and is not pumping very strong at all, we have found that the weaker muscles of the heart are more prone to having a cardiac arrest by having an arrhythmia. So that's another cause. Another huge cause is genetic. You have inherited diseases that can cause sudden cardiac arrest. Certain syndromes, for example, long QT syndrome. And these diseases, the inherited or genetic ones, are usually what causes these problems in a younger population. For example, the athletes that you were just describing.
So is sudden cardiac arrest something that we can survive from? I mean, you mentioned time was an essence.
Mm-hmm.
Can we survive?
It is survivable. It is survivable. Let me give you some numbers. So in 2015, in the United States, we believe there were approximately 350,000 sudden cardiac arrest cases. And 10% of those people survived to get to the hospital. And 8% were considered to have good function afterwards. I mentioned function because if it goes on long enough and you're not getting oxygen to the brain, then you get loss of function and you're probably not going to be the same neurologically. So it is survivable. It's estimated that maybe 1 in 1,000 people, 1 in 1,000 adults, I should say, will have a sudden cardiac arrest, and around 10% will survive. Survival depends on how quickly you get to medical attention or medical attention gets to you.
So can sudden cardiac arrest be prevented? We know that, heart attacks can be prevented, and you talked about genetics. This particular one, it affects people that are healthy. Can this be a preventable disease?
Well, the major part of prevention of this disease is knowing your risk and trying to reduce your risk, and also knowing your body and making sure that if you're having any symptoms that you do seek medical attention before you possibly get to the state of having a cardiac arrest. So what are the risk factors that you yourself need to know of to figure out if you're at higher risk of having a sudden cardiac arrest? So there's things that you can prevent and things that you can't prevent. They're not preventable. So we mostly hear about things that we can prevent. So for example, if you smoke, if you lead a sedentary lifestyle, if you drink lots of alcohol, if you have diabetes, high blood pressure, high cholesterol, all these things put you at higher risk. And you should be seeing a doctor to make sure that these illnesses are controlled to decrease your risk. Things that you can't really control are your genes. So if in your family, you know that there's several people who just suddenly passed away, died, and no one knows the reason, you probably should go get checked out and speak to a physician, preferably a cardiologist, about the possibility that you could be checked for one of these genes that could lead to an arrhythmia. Things that you also need to know, if in your family several babies have had SIDS or sudden infant death syndrome, this is a manifestation in children of sudden cardiac arrest in some cases. So if there are a few family members that, unfortunately an infant passed away from SIDS, that makes it a higher possibility that you do carry a gene for it. Do you know anyone in your family or several people who just drowned out of nowhere? They're strong swimmers and they suddenly drowned in the past, especially as a young person. They were healthy and then, oh my goodness, they drowned. Can you imagine that? That's also an indicator that they could have had a specific type of sudden cardiac arrest while swimming. And then, of course, the athletes. Are there any? Is there a history in your family of some young athletic person just suddenly passing away? So these are genetic predispositions to having this sudden cardiac arrest. But the majority of things are modifiable if you have a chronic illness, diabetes, high blood pressure, if you smoke, if you lead a sedentary lifestyle, if you have high cholesterol. These are things that will increase your risk of heart disease overall and increase your risk of sudden cardiac arrest. See your doctor, modify your risk factors, and decrease your risk. I alluded to, are you having any symptoms? So what should you look out for? Because sometimes you do have a few days or a few weeks of feeling different before this will happen to you. Chest pain, again, if you're having chest pain, go get seen. Don't put muscle cramping cream on it and wait it out, or say, you know what, I need to go relax, especially if you're over 40, especially if you have some of these illnesses. Go get checked out, get an EKG, see if you need to get a stress test done by a cardiologist to figure out if there's anything causing your chest pain. If you're getting winded or short of breath when you're walking, usually you're able to climb 2 flights of stairs, and now after a flight of stairs, you're short of breath. Get checked out. Lightheadedness out of nowhere. You're well hydrated and you're just noticing you're getting lightheaded now and again. Could be a sign of arrhythmia. Palpitations, the heart is racing or skipping a beat very regularly. These things are signs to get checked out to decrease the possibility that you could be having a sudden cardiac arrest in your near future.
So how do we treat sudden cardiac arrest? What's the treatment plan?
Okay, so the treatment, 3 things we have to remember, because we are going to be witnesses. You can't treat yourself when you have a sudden cardiac arrest because you're lying on the floor unconscious. So we're relying on those who witness it, generally outside of a hospital or healthcare setting, to treat the person that fell down until they could be taken to hospital or until the EMS can come to them to do higher levels of care. So the first thing you should do is call 911, because if you do not activate the emergency health service, no matter what you're doing for this person who unfortunately collapsed, no help will be coming. So that's the first thing. So if you're alone, call 911 before you do anything else. If there's more than one person can try to help while the other goes and calls 911 or figures that part out. Okay. The second thing is early CPR, cardiopulmonary resuscitation. We've heard of CPR. CPR involves chest thrusts and giving breaths to try to maintain the oxygen flowing to the brain until the heart can be restarted. In COVID times, and even for a few years before now, we were not pushing the mouth-to-mouth part so much. And it's not expected, if it's a stranger, that you're going to just go do mouth-to-mouth, unless you do have the protective equipment in your pocket, which some people do walk with. But the chest compressions, what you can do, look up online or seek out a basic life support course on how to do CPR. Google it. I think we're also posting some American Heart Association, a link to the American Heart Association. So look at the American Heart Association website on how to do CPR and, get certified. It doesn't take long. And chest compressions, try to compress the chest at 100 beats per minute. And this is the rhythm. This is the rhythm. You should be doing this in your head. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 1 and 2 and 3 and 4. So that's the rhythm. You compress as long as you can. Try to push down to 1/3 of the width of the patient's chest. And it gets tiring. So if you have help, try to switch around every 2 minutes. And then the third thing that we're going to be trying to get done before the emergency and medical services arrive is to get an AED. AEDs are in most public places, parks, libraries, restaurants. It's an automated external defibrillator. It's a small machine that instructs you on how to attach pads to the patient's chest and on when to deliver a shock if it is needed. Because what is needed in some of these cases is defibrillation. Defibrillation is applying a shock externally. It could be internal too, but externally to the heart to get it out of this arrhythmia, which could be fatal. So activate the emergency medical services, call 911, start CPR as early as possible, and defibrillate or use an AED, automated external defibrillator, as quickly as possible if a shock is needed. And the machine will tell you if a shock should be given.
So it sounds like some people can survive.
Yes, some people can survive.
What's the treatment plan post usually for a sudden cardiac arrest?
Okay, after a sudden cardiac arrest, these patients definitely have to be admitted to the hospital. If they wake up, that's excellent. 10% survival, so 10% of people wake up, and 8% of people will have good function after. So that means 2% will not. They're going to be incapacitated in some way, not have their usual brain function that they did before. So in the hospital, what's being done now, medications are given, investigations are done to see the cause, and then many of these patients will need eventually to have a defibrillator implanted. Those for whom a heart attack was the cause of the sudden cardiac arrest will be taken to place in a hospital called the catheterization lab to do a procedure to open up that blockage in the blood vessel. So they'll be taken to the hospital, a workup will be done to find the cause, and acutely they'll be treated by opening a blood vessel if that was a cause. If it's an arrhythmia, they'll be given medications, and they will have a defibrillator implanted before they get discharged if it was an arrhythmia that caused it. A defibrillator, an implanted defibrillator, is a small device made of stainless steel, usually about 3 inches diameter, which is implanted in the body, that in the future will supply shocks inside if they need it to prevent them from collapsing again.
That's also called a pacemaker, is that correct?
A pacemaker is a little different. Both of them look similar. They're the same size and they're implanted the same way, but a pacemaker is used in people who their rhythm is abnormal and it's initiating a normal heartbeat. So a pacemaker is working all the time to initiate a normal heartbeat on a patient. And when you do an EKG, you see it. You see that they're being paced, as you say. Excuse me. But the defibrillator basically stays there and monitors you internally and is just waiting for an arrhythmia to treat it internally or to give you a shock internally.
Oh, interesting.
So a defibrillator gives you a shock, but a pacemaker helps your heart to beat.
Oh, thank you for that. Because I thought they were interchangeable, doctor. That's really good to know.
Yeah, 2 different things. Mm-hmm.
So what can we take away from this? You talked about arrhythmias and genetics and really things that we can't, some things that we really can't control, and then other things we can, a better lifestyle, and we're well aware of all the different factors that can cause heart disease. But what about the things that we can't control, like genetics? How can we prevent some of the things from, going haywire on us?
Okay, so what I want you to take home is, again, firstly, if you are an observer and someone collapses, or you happen to come upon a scene where someone collapses from a sudden cardiac arrest, the earlier intervention is done, the better their chances of survival. So that's the first take-home message. So call 911, start CPR, and get the defibrillator if you're in a public place. The second thing I want us all to know is individually, we need to know our family history, and we need to know what risk factors that we can modify. We can't really modify our family history. We're all walking around. We don't know the different genes that we have or different things that we are likely to get later on in life. But we can look at how we feel within ourselves and know how we're feeling in terms of symptoms. And if we're feeling symptoms, then we need to seek medical attention. So if there's anything going on, it can be caught before it gets to sudden cardiac arrest. And the third thing is modifiable things are smoking, sedentary lifestyle, diet, control of your diabetes, control of your high blood pressure. So try to eat a diet that's low in salt, low in fat. Try to exercise for 30 minutes per day, something that's going to make you sweat. Stop smoking if you can. Ask your primary doctor to help you with medications or patches or gum if you need to. And if you have diabetes or high blood pressure, follow regularly with your doctor to make sure they're as well controlled as possible so they're not affecting your organs internally to cause you to get sick with your heart further on.
This is great. This is you hit a lot of great points, especially telling us the difference between a heart attack and a sudden cardiac arrest. So I really do appreciate you taking the time, doctor, with us today and to talk about this, because it's an important topic that everybody's educated about. And if you like to view this again, or if you weren't able to sit in on the whole thing, it is living on Facebook Live as well as YouTube. And thanks again, doctor, for being with us. And if you'd like to support our foundation, please visit us at www.newbridgehealth.org. And we're wishing you all well. Thank you, doctor.
Okay, thank you so much for having me, Rosemary. It was such a pleasure.
Thank you.
Thank
Take
you.
care. Bye-bye.
Bye.